Hello, Dr. John here with today's Headache and Facial Pain Institute. In this video, I want to cover how we diagnose virtually every type of head pain problem. Whether you're dealing with something as complex as migraines or as simple as jaw pain or TMJ, we are here to identify the cause and guide you towards effective treatment. We hear a lot of the same story from our patients. I have been to every specialist, tried every treatment, every medication possible, and nothing is working for me. Well, you're not alone. As a board-certified craniofacial pain specialist, I have diagnosed and treated tens of thousands of patients that have told me the same type of story. The rest of this video is going to explain to you the steps of how we diagnose that and the type of treatments that we may recommend for you. Now, we also hear another story from patients that have possibly visited another specialist that deals with these type of issues. And we hear that, well, there's a treatment program that they have and it costs $10,000. I don't know exactly what they're going to treat me for or what they're going to do, but I've been in for a consultation and I have to go back and commit to this type of a financial commitment to be able to get treatment. I can tell you that this problem is very personal to me. I have had TMJ problems from the time that I was 18 years old. I've had headaches. I've had chewing problems. I've had family members that had migraines. So I know what a toll it can take on your personal life and on your family. And I have dedicated my professional career to learning how to treat these type of problems, learning how to diagnose them, where they come from, and what the options of treatment are. So again, it's a very personal thing for me, and I can assure you that we are not going to place any sort of roadblocks for you to come to our office and get some answers, get even some simple basic treatment to help you with your pain. So if you're looking to schedule your first visit, all of our diagnosis starts with a consultation appointment. So please watch the next video called the consultation appointment so you can understand what you need to do to give us the answers by filling out the consultation form and whatever medical records you have to send to our office before that consultation appointment so that we can sit down and get to know you, your history, your treatments, what you've been through before, what you've done, and what has worked, what hasn't worked. And then we can complete that consultation appointment where we will look at the different things that's happening with your jaws, your neck, and everything that might be causing your pain. Now, during a consultation appointment, we cannot give you a full diagnosis, but we can give about 80% of our patients a good idea, a preliminary diagnosis of what may be happening with their pain and their symptoms of where things are coming from. One of the things that we see in about 80% of our patients that come in for that consultation appointment is what we call, at the sake of being crude, we call it jaw abuse. And that has to deal with the fact that about 25% of the population clenches, grinds their teeth, and to a certain extent self-abuse their teeth and their jaws and their joints and their muscles and all of these components. So it's not because we're trying to scare you, but it is a factor. It is a very common denominator between a lot of the patients that we see that have chronic head pain problems. Most of our patients don't even realize that they're clenching so much or that they're doing the wrong things with their foods. And that is why I stress to please watch our soft food video that explains these factors and talks about how you should be using your jaws and what all of these other factors may be that are contributing to the damage that you may be causing. So you're not alone. I do it. A lot of my family does it. My friends do it. There's just a lot of people that do that and don't even realize they're doing it. So we are looking for the jaw abuse problem in the consultation appointment. And about 50% of the patients that come in for the appointment are going to start some immediate basic simple treatment. And what I mean by that is that if we need to address the problems of clenching, grinding, and muscle dysfunction, We're going to start a treatment with anti-clenching devices, and we may recommend some physical therapy and possibly some other evaluations with specialists such as PMNR or neurotype specialists. And the reason that we may recommend some treatment that is simple, basic, and inexpensive is that we want to start breaking the habits. We want to get you some relief. And not everybody has a chronic damage problem. So if we're going to recommend that type of treatment, we're also going to see a lot of our patients, about 80% of the patients that come in our door have had some form of treatment. They've had a mouthpiece. And I can tell you that over 90% of those mouthpieces are incorrectly fitted. They're usually the wrong design or they're fitted wrong. So when we switch somebody to the correct mouthpiece and the correct treatment, they usually see immediate results. What I mean by that is we are in control of any sort of mouthpiece or treatment that we recommend. We design and fabricate those from start to finish, because every patient is different, every mouth is different, every bite is different, every alignment is different. So when we're in charge and we're doing it ourselves, the treatment outcome is significantly better. And again, I do stress that the majority of the mouthpieces we see are just incorrectly designed. Once we get a patient under that sort of recommendation, again, 50% of them will start that treatment right away. And if they do not have a chronic joint damage problem, they can see more than 90% pain relief just with simple treatment. Now, the other 50% of the patients, we're giving them a good idea that they most likely have a chronic joint damage problem. And now the only way to diagnose that is to get a TMJ CAT scan, a three-dimensional x-ray in a 40 by 40 view of the joint area that tells us and shows us whether there is any sort of damage to the bones, the cartilage, the ligaments. Yes, you can also get an MRI. Even your physician can order that. But please remember, if let's say you're not in our area and you can't come to our office and you're looking to get a diagnosis for these problems, get at least a TMJ CAT scan, but make sure that your back teeth are touching. If you're doing an MRI, the same way. Please remind the technician to make sure that your back teeth are touching during that study. Otherwise, if these teeth are not touching, the test will be inconclusive. When a consultation patient decides to get a TMJ CAT scan at our office, because we complete that test here, it's done within 5 minutes and they have an immediate answer as to whether or not they have a chronic joint damage problem. If we diagnose them at that appointment with the jaw joint damage problem, then this patient will have to consider more complex treatment. Doesn't necessarily mean that they're going to come back for more extensive testing or more complicated treatment. Many of them will still start with a basic, simple treatment for clenching, grinding, maybe physical therapy, and they can see spectacular results, probably not as high as 90% if they have a joint damage problem, but they will still achieve about a 50% success rate. When the patient is interested in getting a more comprehensive diagnostic type of evaluation of everything that's going on from here on up, then they have to return for that test. And during that test, we perform a multitude of different things. Now, if we recommend to a patient that we are diagnosing with a chronic joint damage problem, if we're going to recommend a more comprehensive examination, that examination is going to include certain things such as possibly a full dental evaluation, jaw x-rays, sonography studies of the cartilage in the jaw joints. Of course, a full health and symptom history, review of medical and dental conditions, neurological examination, muscle testing, jaw, neck, shoulder posture testing, medication, treatment histories, sleep and nutritional evaluations, occupational, environmental influences, history of injuries, history of orthodontic treatment, and a multitude of other things that we're looking for in order for us to be able to provide an accurate diagnosis, and then more specifically, to give the patient some options of treatment. Now, these treatment options may most likely still include a simple treatment that we start with in terms of breaking clenching habits, doing some physical therapy and things like that to get the patient some immediate help and possibly prepare them for more complicated treatment that is aimed at rehabilitating the jaw joints, getting things to heal, and getting them to closer to 100% symptom relief. The reason I bring up a lot of percentages is because we see a lot of patients, so we look at percentages quite often. As I stated before, 50% of a consultation patients can get simple treatment, and many of those can achieve above 90% success rate. 50% of the other patients that we feel have a chronic joint damage problem, if they do simple treatment, they will see maybe 40-50% symptom relief, but not 100%. If they're going to come in and follow our more complex treatment options, they can expect to achieve above 90% success rate as long as they do things in phases. And one of the reasons that we do our treatment in phases is we want our patients to be able to see improvement at every step of treatment until we know that we can get them 100% or at least close to 100%. So that is why we don't throw anybody into a box of a $10,000 treatment or put a roadblock for them to come in, because even our chronic patients can get relief with very simple, inexpensive treatment. And like I said before, we're very transparent. We want to help patients. We want everybody to come in and be able to at least get some self-management advice and understand their problems so they can start doing things to alleviate their symptoms and prevent their problem from getting worse. So I hope that this helps. I hope you understand what we're doing in terms of this first appointment. This starts with the consultation and may proceed to more diagnostic steps along the way.
Here is a quick recap of our diagnostic procedures for new patients. First, schedule your consultation appointment and watch our consultation appointment video. Be prepared to email us as much medical and dental information as possible before this appointment. It is also important to make sure that you have had a full diagnostic evaluation with your primary care physician and follow their recommendations for possible need of completing a brain MRI or examination by a neurologist. The consultation appointment allows us to be able to provide you with some basic answers about your pain condition. At this appointment, you will have the option of starting basic treatment if you have problems with clenching and grinding. 80% of our consultation appointment patients have chronic clenching and bad chewing habits. They also have improperly fitted mouthpieces or have completed other ineffective treatment. If you are one of these patients, we can quickly get you started on the proper and affordable treatment option. We do not have one-size-fits-all expensive treatment programs. We make our services available to everyone. You will also have the option of completing a CAT scan if Dr. John feels that you have a chronic joint condition that requires full diagnosis. The CAT scan results can be completed in under 5 minutes. You will be provided with all possible treatment options if the CAT scan results show that you have a chronic condition. If there are additional testing requirements, such as a neck MRI, you will be referred to other specialists. Our treatment success is over 90%, including chronic conditions such as migraines. We will provide you with any treatment limitations based on your medical conditions and give you answers about what to expect. We provide different treatment options, and all our care is done in phases of treatment to allow gradual improvement. You can schedule your first visit through this website or by calling or emailing our office. Thank you for watching.